Dr. Caroline Clarinval, thank you for joining us. 75 years of WHO, a lifetime. What are its greatest successes, if you can make a top 3?
So thank you very much for having me. WHO is one of those United Nations organizations that rose after the Second World War, at a moment where the world got together and tried to establish a new environment. WHO was looking after the health of the populations around the world and did not only look at it from a medical perspective but also from a human rights perspective, trying to ensure access to healthcare services for all people. Some of the great successes are, for example, the eradication of the smallpox. Another great success is the progress that we make in eradicating polio, which is a significant disease that affects numerous people, but at the same time we have been able to decrease the numbers of people that are affected by the disease and to protect them through vaccinations around the world. There are 3 countries today that are not yet free of polio. One is Pakistan, Afghanistan and Nigeria, but most of the other countries in the world have made an enormous progress in order to eradicate polio. WHO is strongly committed to continue this effort, and at the same time WHO has also made enormous advances in mother and child health care, especially also in promoting immunization in general. So the vaccines that are being administered to young children have helped WHO to decrease the morbidity and mortality of the children. So that would be my first big 3 for today.
For Romanians also it has an impact, the presence of WHO.
So when I look at the exhibition of today, so the idea originally to celebrate the 75 years of WHO was to showcase some of the key moments of advances in healthcare services in Romania. And so when we worked with colleagues from the universities and the archives, they did show us the importance that vaccinations had in the days. And we can see in some of the images that populations were really keen to be vaccinated in order to protect themselves from disease. Another thing that we can see is the populations had difficulties accessing some food and nutrition, and here as well efforts have been made in order to promote that. Then an important point is the efforts that were made to train the healthcare workforce. Right? A health system without its doctors and its nurses is not able to support its population. And here Romania as well, they have engaged in developing all the hospitals, they have engaged in training the doctors and the nurses, they have engaged in providing healthcare services to the population for free, which is a significant political commitment. And WHO, since its arrival in Romania in the 1990s, has accompanied the government, and more specifically the Ministry of Health, in establishing their service, in supporting them in the establishment of their healthcare services throughout these decades in a close collaboration.
WHO maintained its office in Romania. What does it show?
There's been sort of an evolution of the types of activities that WHO has engaged with here in Romania. One of the key works of WHO is its normative side of work. So WHO is an organization that provides and drafts standards and guidelines for the healthcare workforce. The trick in this is to make sure that those standards that are developed at the global level are then translated into what is appropriate for the local context. So here, in collaboration with the Ministry of Health, as well as the scientists, as well as the doctors and nurses, WHO has supported the Ministry of Health in making sure that some of those global guidelines are integrated into the national guidelines. More recently, we have also started to support the refugees of the Ukrainian crisis, but here in the end, again, the effort is done by the Ministry of Health and the government. It's the government that looks after the refugees and that makes sure that the access to the services is being provided. Our contribution is just in order to facilitate that access in certain areas. And then, on another side, WHO has engaged more recently in the area of the PNRR plan, where we work very closely with the Ministry of Health in 3 areas. And those 3 areas are really critical to strengthening a healthcare system. One is human resources for health, which means strengthening the knowledge and the expertise of the doctors and the nurses. The other one is quality of care, to ensure that the services that are provided respond to the expected standards. And the third one is digital health. And digital health is in everybody's mouth nowadays. It's an important area of work where Europe in general engages in.
The pandemic was the biggest challenge for our times, and the trust in vaccination decreased lately. How do you try to get it back?
It's a very good question. So WHO, in supporting the Ministry of Health, we are engaging in raising the awareness of the population, but not only of the population in general, but more specifically of the family doctors. Because when you have a mother and a sick child that come and see the family doctor or the pediatrician, these are the ones who can then recommend that the different vaccines are being taken according to the national protocol. So for us, we are here to engage with the family doctors and the pediatricians, as well as with the general public, in that debate and in that discussion that yes, how that vaccines save lives, and that they are evidence-based and proven safe to be administered. So for WHO, vaccination is one of our key programs, and here we are very happy to engage with different communities as well as with different bodies of work, and in order to promote the uptake in vaccines among the population.
You know, there were many conspiracy theories lately, and in this context there was the release of the Global Health Certificate with the list of vaccines. What is the purpose of this certificate?
So this certificate is one of those initiatives that joins WHO and the European Union. So during COVID-19, many countries have developed their own systems, and I think there is a global effort, there's a European effort in order to bundle the lessons learned and to provide that optimal tool that is interoperable across the European Union to the member states. I think COVID-19 has demonstrated that there's many things that we can improve as countries or as health systems or even the civil society. So in the end, everybody plays its role. When we look at digital health, this is a big area of innovation. It's an area that currently requires a lot of effort and political commitment to be reinforced, because once it is applied, once it functions well, it actually aims at easing the processes. And one of the key aspects is that people will have an easier access to healthcare services. The information will be shared easily amongst the healthcare workers as well as the patients. So the aim here is to optimize access to healthcare services.
Because, you know, many fear that it will affect their freedom of movement if they are not vaccinated.
We saw that during COVID-19, the countries have adopted different rules. WHO monitored all the different rules that were spelled out by the government, or that were imposed by the government, and we were monitoring them. We were also engaging with the governments in order to facilitate the access to information at the points of entries, and we were in the dialogue with the governments to facilitate that people can still move across countries. The purpose ultimately is not to restrict the movement. The purpose is to learn from the experiences of COVID-19 and to develop a system that would allow us to protect the region in an era in case there would be another pandemic. And it's just a tool. So there's many different tools, and tools can be adjusted. What I think is more important here is this commitment across the region, wanting to learn from what has happened during COVID-19 in order to give us the tools to improve any future activity.
The mental health was affected during the pandemic. How can it be restored?
I think mental health is one of those areas that is very dear to my heart. I think not only has it been affected during the pandemic, but people during their lifetime inevitably go through phases where our mental health suffers because of trauma, because of sad situations, and or because of a change in our life. And I think there are multiple moments where we should proactively seek out for help. What COVID-19 told us is that mental health is yet now on the top of the agenda of many governments. We've understood that we need to promote access to mental health care services, but that means that the psychologists and psychiatrists need to be trained, that the services need to be made available, they need to be reimbursed, and that people overcome the stigma to seek for help. And I think here the dialogue and the debate is also extremely helpful in order to promote the engagement of the population in the area of seeking mental health care services on time.
The obesity levels exploded also. It is a chronic disease now, but many people do not afford to have meal plans, to go to a gym, to have healthy food because it's expensive, you know. What is the solution in this case?
I think raising awareness about a healthy lifestyle in general is important, and that has multiple factors. Nutrition is one of them. Accessing healthy foods is extremely important, but at the same time we have busy lives. Sometimes we can't access them the way we would like to, and we grab a snack. So the idea is to change those habits. That is not necessarily very simple. One thing is that it's also important to start educating our youth and to already also inform our children to have that discussion at home about nutrition or what is a healthy nutrition. And to otherwise try to make those little habits and to put them in place when we can. I think it's just a question of mindset as well, and that also includes integrating physical activity into our lives. So some people have different preferences on certain areas of physical activity, and I think it's important that we find a way to integrate physical activity as well as a healthy nutrition and a healthy mindset and the mental health into our lives in general.
Tuberculosis cases have multiplied in these years, and there are still patients who do not get access to the treatment. What to do?
So tuberculosis is also one of those areas that require a continued effort. Patients need to be detected on time. They need to have access to the appropriate treatments, and it's a treatment that requires a continuous, for a certain period of time, treatment in itself. So there's a level of compliance, of commitment, and a health system that needs to be put in place in order to support those patients that have tuberculosis. So it's one of those areas that also WHO is working very closely with. There's a strong commitment at the Ministry of Health in order to address the issue here in Romania and to provide the appropriate treatment regimens and medicines for those patients, and to make sure that the patients that have tuberculosis, that they are quickly identified, diagnosed, and that they have access to the care when required.
Many people do not even have access to medical services due to the lack of medical staff. And many health professionals you have seen they were in the street requiring higher wages. You have seen the protests, but the higher wage is not enough.
Healthcare workers are a precious good. We ought to look after them. They invest an enormous amount of years of their lives in their studies. They're very committed to their patients and to the healthcare system. And they come, and what I find particularly impressive here in Romania is the level of dedication and empathy that they have for their patients. for a healthcare system to run optimally, it's important to retain those healthcare workers, as well as to make sure that the next generation of healthcare workers has access to the universities and to the education, and that they are being inserted then in the health system as required. So the effort, the political commitment in order to make sure that the healthcare service has access to sufficient healthcare workers is currently an important area of work that the Ministry of Health is focusing on with WHO. And in this context, in March this year, we signed the Bucharest Declaration that had a very strong emphasis on maintaining healthcare workers in the system and in supporting them in their work, and to just make sure that the health system is properly staffed in order to provide the required services to the patients.
What are the next challenges?
I think an important one is preparedness. Is for the following COVID-19, I think we have understood that many governments are not necessarily prepared appropriately in order to prevent or in order to respond to such disease outbreaks. So personally, I think looking back at the last few years and all the efforts the healthcare workers have done and the ministries in order to save people's lives and to make sure that the mortality and morbidity rates decline, have highlighted the need for governments to strengthen the healthcare system and to prepare them better, the entire government, because oftentimes it is a multi-sectoral response that is required, in order to make sure that we are able to look after our population in the most appropriate way.
Thank you for this interview and happy anniversary.
Thank you very much. Thank you very much for having me.